Thank you all for being with us today. Jay Ziabart, nutritionist and health educator, and I'm Megan Mesher-Cox. We host this disease prevention and reversal summit and hope to be able to provide more information out there. So good information that's really evidence-based healthcare information and truly lifestyle medicine. Okay, our next speaker, such a treat to have Alex. Alex is a physician assistant for cardiothoracic surgery. So he's in there doing cardiothoracic surgery, seeing, unfortunately, the end product of the standard American diet. We're thrilled to have him here today. We're talking low-tech solutions for health in a modern world. Alex has been in our community for 6 months now or so, and hopefully that he'll stay. He's such a great asset, and he talks to people all the time about how to prevent another heart attack or another open heart surgery. So I'll hand it over to you, Alex.
Okay, thank you, Megan. Thank you, Megan. As she said, my name is Alex Jonusas, and I want to go over some very simple solutions, maybe 2 or 3, for optimizing our health in this modern world, especially now. We're having these Zoom meetings. We can't get together because of COVID, these novel coronaviruses, and now it's the winter, and we see, these surges happening all throughout the world, and especially in the United States. And so I want to empower our population, our patients, our community with simple things that we can do that don't require technology. And so basically, who am I? That is a very deep philosophical question that I could probably never answer. But as Megan said, I am a physician assistant in cardiac surgery, thoracic surgery, and vascular surgery. I come from Miami, where I've worked for about 15 years in the busiest centers there in University of Miami Hospital and Mount Sinai, applying the latest cutting edge technologies to our patients. And I had the opportunity about 2 years ago, had a brief stint right outside Sedona, Arizona, which is in a little town called Cottonwood. And what started becoming obvious to me after at least 15, 16 years of surgery is that our patients would come in, and oftentimes on death's door, and we would apply the best of technology that we could, and we'd get them out of the crisis sometimes, not always. But what I noticed is that they would come back, and the longer you were in surgery, I started seeing our repeat patients coming back for second and third and fourth surgeries. And it gets to the point where we could not do anything for them anymore. We couldn't apply our advanced technology to help them out. And so this really opened my mind to lifestyle medicine. And the power for healing yourself doesn't come from a technology that we apply from the outside. The power to heal oneself, the power of health, comes from within. What we do each and every day with our lives. And so most of us take for granted what is health. We all think we know it, right? We all know what health is. But if we really start to think about it, it can open up some avenues for us to pursue. The World Health Organization defines health as a state of complete physical, mental, emotional, and social, and not merely the absence of disease or infirmity. So what does this wellness, this sense of wellness mean? Health is intimately tied with the sense of wellness. Well, wellness is the subjective, positive experience. I think it is an experience of wholeness, of contentedness, of happiness, of purpose. When we start to view health in that context, not just I don't have a disease, but with wholeness or through purposeness, then we see that health is not solely a physical process. It's not solely a physiologic process. It is a dynamic, an interdependent state that is informed by everything we do, and in turn informs every aspect of our lives. This has been studied. And so real quick, I just want to bring up a quick slide. I don't want to get bogged down, but there's the researchers who follow this, and it's been vetted out, shows that there are 5 pillars of health, and these are called the social determinants of health. And as we see, economic stability, the neighborhood in which we live in, the physical environment, education. It's known that the more education you have, the better usually your health is. Food, which we will get into, obviously, the social support, the community, and the healthcare systems that we have access to. And it is here where I want to really just kind of explore briefly with you that in each of these pillars inform what we do, how we feel, gives us a sense of wellness, gives us a sense of purposeness. And we as healthcare providers, we can engage with our community, with you, with our patients, to empower you, to give you the education that you need to make the best choices. And so as we do this and as we explore in these next 10 to 15 minutes, I want to revision health with you. I don't want it to be sick care, which is what a lot of us practice. You come to us, I do an assessment, I look at you, okay, you're a good candidate for surgery, set you up for surgery, bring you into surgery, give you anesthesia, cut, do all this, or go and give you a pill. That should be at the end, that should be a smaller and smaller amount of what we do. I want to bring health in the broadest sense of it, because modern technology has added years to our lives, no doubt about that. But is it adding life to our years? Are we living out the ends of our life robust, traveling with a sense of purposeness? And I think we all can. And so in that vein, I want to share 2, maybe 3 simple steps that we can do in this wintry time of acute respiratory infections and novel viruses. What can you do to make yourself a more robust individual? And so I would say 2 simple solutions would be to befriend the sun. Spend some time with it. Get your daily doses of vitamin D. Vitamin D exists in 2 forms, vitamin D2 and D3, which we will go over. The other thing I would invite you to do is let's start coloring our plates with the rainbow of nature's bounty. Load up on those veggies, those fruits, those legumes, those nuts, and see, let's partake in the abundance that nature provides for us. Now, a real quick, hopefully a 5-minute exploration into what vitamin D is and it does, and we won't go into too much depth. But as we know, most of us know, vitamin D is acquired through the sun and through foods, right? And it exists, as I said, as vitamin D2 and vitamin D3. And some of us know that it has something to kind of do with some bone and this and that. And actually it does, right? It regulates calcium and phosphate, and it makes sure that it mineralizes our skeletal system so we could have robust, strong bones to get around a skeletal system. But I don't know how many of us know that it actually regulates our genes. And so vitamin D it modulates or turns on or off approximately 10% of our entire genome. Our entire genome is about 21,000 genes, and it activates in one way or another about 2,500 of those genes. And so in addition to that, it's not only a vitamin, but it's a hormone, and it's an immunomodulatory hormone. What does that mean? That's just a real fancy way for saying it works on our immune system. It can turn it off or it can turn it on. Almost all of the different white blood cells that we use to fight these viral infections, acute infections, bacteria, fungi, viruses, all of our white blood cells have vitamin D receptors. Not only do they turn these on and activate them, they also produce these cool little proteins, polypeptides, which directly puncture holes into the invading or the foreign bacteria, fungi, viral. And so not only does it work in stimulating our immune system, but it also down-regulates it when it gets too stimulated, right? And so who has heard of ARDS or the cytokine storm? So scary, right? You know, oh, our immune system went in overdrive and now we're producing all these inflammatory cytokines, and all of a sudden our lungs start to fill up with fluid and we have a hard time breathing. Well, guess what? Vitamin D plays an essential role in modulating that. It tamps it down. It decreases some of these factors, these proteins. One particular one that's in the news constantly is interleukin 6. It taps it down and it strengthens our vascular system. It works by stabilizing the inside of our arteries, which is the endothelium, and it works by decreasing the vascular permeability. So what happens when patients get this acute respiratory distress syndrome and they're having fluid come into their lungs and whatnot, right? It starts to leak. Fluid starts to leak through the capillaries and we start to have a hard time breathing. Well, guess what? Vitamin D directly can tap down the messaging system that allows that to happen. Some other interesting things. Vitamin D stimulates nitric oxide, which has very many beneficial effects, but it's also one of the most potent antiviral substances that we have. And in fact, they have looked at using nitric oxide, and they have done it successfully as a way to kill SARS-CoV-1 and 2, which is the one we're dealing with right now. It helps in regulating the renin-angiotensin system, which is this ACE2 receptors that we all hear about, which is how COVID gets in. And so I'm going to real briefly go over some of the studies that show you how it works this. But with all these wonderful things that vitamin D does, how much should we have? Do we even know what our vitamin D3 levels? Have we been to our healthcare provider, our wellness provider, and say, what is your current vitamin D status? And so in America, the normal levels, if you go get a vitamin D serum, a status, and if you score between 20 and 40, that's you're pretty normal. But there's growing evidence based on experts, based on the evidence that this minimal range should be closer probably to 30, in that based on the studies, the sweet spot for optimal immune function is probably somewhere in the 40 to 60 nanogram range, okay? Even at this low level that we have set of 20 to 40, 70% of Americans have less than 30. And almost 1/3 of all Americans have less than 20. When they look at all the vitamin D serum blood samples that we have, the average American has around 24 nanograms per milliliter, as compared to traditional societies that lived much closer to how our ancestors lived. And they found these traditional pastoral societies, such as the Maasai and the Hadzabe, to have around 46 nanograms per deciliter of vitamin D3 circulating throughout them. And so that kind of gives us a good understanding of what our ancestors kind of had. And I'm not going to go into great detail, but I just think it's so fascinating. I want to empower all of you. And so there's a ton of studies, and I can hand them out if you wanted to, but these are just some that I think you will enjoy. And so in 2017, they did an analysis. They gathered 25 randomized controlled trials, which is like the gold standard of how do you do a study in science. And so there's something called the randomized controlled trial. And they collated 25 of those studies. And it was, I think, 11,000 people in there. And what they found was that when you gave them weekly vitamin D supplements and you brought up their serum levels, you decreased the risk of acute respiratory tract infection by 50%. So I think that's pretty amazing. I don't know about you. In another study, this one's called the UK Biobank study done last year, they found that vitamin D levels between 45 and 60 nanograms. Remember, I told you that is kind of the sweet spot. Most experts on this agree that they had a 17% lower cause of all-cause mortality. These people had 23% less mortality from coronary vascular disease, which is our #1 killer. And if you combine this with eating a plant-centric diet, your cardiovascular mortality rate is going to plummet. And when they looked at cancer, 11% less cancer mortality in patients who had a vitamin D level between 45 to 60 nanograms. They also last year, they did a very interesting study, which showed that COVID mortality is directly related inversely with your vitamin D status. So what does that mean? The lower your vitamin D status is at the time of infection, the higher chances you have of having a bad outcome. And they found that if you're infected and your vitamin D levels were at 30 nanograms or above, you had a significant decrease in having serious symptoms. And in this particular group of patients that they look at, they did not find any deaths in patients from COVID-19 with a vitamin D3 level at 50. Again, that doesn't mean that vitamin D can be used to treat COVID-19, and it doesn't replace vaccinations, it doesn't replace social distancing. But what it does show you is that if you're giving your body the optimal amount of what it needs, the right stuff, if you're not in a chronic state of inflammation, your body will be able to handle infections and foreign invaders much easier. Now, for the last study that I found fascinating is that this was done in Cordoba, Spain, at the University Hospital. And they had 76 total patients who were admitted to the hospital with COVID-19 pneumonia. They did a chest x-ray and they did a CT scan and they had pneumonia. And what they did is all these 76 patients got the standard care of treatment at that time, which was over about a year ago, which included certain drugs like hydroxychloroquine, certain amount of steroids, azithromycin. And what they did is, of those 76, they took 50 and gave them vitamin D3 at admission on day 3 and day 7. And the other 26, they just gave them the standard of care. And what they found is in those 50 in the treatment group, only one of those 50 ended up going to the ICU. And this patient did not die. And actually, I think was discharged 11 days after. Of the 26 who were just giving the standard care, but not the vitamin D, 13 went to the ICU and 2 died. So these are just some things to think about. The other powerful step that I think we can do is please eat a plant-centric diet. We have known that consuming mostly plants for the last 50 years is maybe one of the single best things that you can do for your health. And real briefly, as I'm sure many of you here already know, but I just like to hit some major points, that what do these plants do for us? Why should we be eating them? Why should be the majority of what we consume? Well, plants support our immune system, right, which is what we're talking about right now because of the dreaded respiratory infections, by providing an abundant and a diverse source of different vitamins, minerals, phytochemicals, antioxidants, and fiber. And fiber, if there is a superfood, it should be fiber. Fiber maintains our gut health, where around approximately 70% of our immune system is located. Having a healthy gut leads to increased transit times, decreases weight, allows us to better absorb the nutrients, and it decreases cholesterol, which is my domain, which will help you prevent from having a heart attack. It reduces chronic inflammation, and it also maintains a healthy weight. Most of us struggle with different diets. What should I do? What should I not do? But just eating a plant-centric diet will help you achieve your normal healthy weight. Plants are so powerful that I want to share this with you. In July to September of last year, they looked at almost 3,000 frontline high exposure healthcare workers. What does that mean? These were nurses and doctors who worked at least 4 days out of the week directly with COVID-19 patients who had been admitted to the hospital. They did an intake, they took different demographics, they looked at the diets, and they wanted to follow them over these 3 months. Of the almost 3,000 patients, 568 healthcare workers were infected. When they looked at this, they found that those who consumed a predominantly plant-based diet had 73% lower odds of developing moderate to severe COVID-19. So if I told you, if you could decrease your chances of having bad symptoms from an infection just by simply eating a plant-centric diet, I think most people would take that. In addition, they looked at pescatarians who mostly consume plant-based diet, but they ate fish 1 to 3 times per week. And they also had about a 59% chance, lower odds of having any kind of moderate to severe symptoms. One thing I find very interesting is that in our communities and in our country, many patients or many people are trying to lose weight. And so they follow these low carb, high protein diets, advocated by certain nutritional gurus. But in this particular study of almost 3,000 healthcare workers, they find that those who ate low carb and had the highest protein intakes, it was associated with a greater chance of having moderate to severe symptoms. So, summary for simple steps to wellness. I hope that I was able to kind of open your mind and show you that health is not just the absence of disease, but it's a complex, dynamic, multifaceted state. And we have to take care of every facet of our health to have optimal health, to open the aperture to see it on a bigger scale. Color and fill your plate with plants. Get the majority of your calories from plants. As you see, it does have a very real world effect on our wellness, and especially in these times of the scary respiratory infections. Try to aim for 150 minutes of movement a week. That's about 30 minutes, 5 times. Try to make it green. They call it green exercise. Green exercise is exercising out in nature. As we know, being exposed to the sun for little bits of time is very beneficial. Work with your healthcare worker, work with your providers to see what is your vitamin D status. Work with them to see where you're at. I think these are some simple solutions so we can all enjoy the ride. Thank you very much.
Alex, that was awesome. Thank you so very much. Especially great to hear, yes, we know you're in cardiovascular surgery, excuse me, but to hear the large wheelhouse that you cover too, right? Outside of the lab too. Awesome. A couple of questions, please. As far as befriending the sun and the vitamin D, what would you recommend to someone who's worried about, worried about skin cancer?
Correct. That's always the dreaded. Should I do this? And so when we put we put sunscreen on ourselves, we kind of decrease it, right? So there's different bodies of thought on it, but they would say, most people should try to aim to get 20 to 30 minutes of sun exposure a day. If you put in some sunscreen, obviously you're decreasing the amount of vitamin D your skin synthesizes. And if that's a concern, I would say simply supplement. Work with your healthcare provider, see what your vitamin D level status is, and simply supplement. It's so simple. It's wonderful.
Awesome. Now, nitric oxide, you talked about the power of nitric oxide. I know I've had a lot of patients, and I'm sure you've seen it too, patients that are taking a nitric oxide supplement. What does it work as a supplement, and what would you recommend to people that really want to increase their nitric oxide levels?
Oh, so does it work as a supplement? I'm not quite sure about that. It may have a small amount, like maybe if you go before a ride. Actually, there's studies showing that they give beet powder, which your body can help create into this nitric oxide, and cyclists are able to exercise a lot harder. But I would suggest, again, just what I keep saying, eat the rainbow, eat a bunch of green. You want nitric oxide in your body? Green leafy vegetables are potent sources. Learn different ways to get that into your body. Learn how to eat beets. There's many different ways to get it in. And so, in fact, I would even go to say there's a doctor from the UK, Professor Tim Spector. I don't know if any of you have heard, but he runs Zoe, and it's one of the largest kind of places where research is done in the UK. And he says, if you want optimal health, try to aim for 10 different types of plant matter a week, because it's not just eating plant matter, but it's having a diversity of the microbiome. And so I think that's a really good suggestion by Professor Spector.
That's awesome. And actually that segues so well into, because the next talk will be Jay talking about gut health. And then one more question here, please. As far as vitamin D supplementation, I know you commented on it, but I want to make sure that that we hear you clearly. It sounds like vitamin D supplementation can greatly help reduce COVID in patients. What do you recommend? And have you seen patients that have not gotten the vaccine, perhaps, but they're taking vitamin D to help prevent COVID? What would you recommend to them?
Again, I mean, we're here on this forum. And so again, I would really say that before we supplement, we should know what our vitamin D level 3s are, and I would say that I would work with your healthcare worker. I think not only for COVID, but it decreases all sorts of other acute respiratory infections. And actually, if you look at it, low vitamin D status is associated with diabetes. It's associated with allergies and asthma. It's associated with multiple sclerosis. It's not the cause, but it's associated with it. So I think the best way to do is get checked and work with a healthcare worker who can kind of guide you. I don't know how much you need. Do you need 4,000 international units? Do you need 10? Do you need 3? So the best way is get it checked and work with your provider.
Fantastic. And just one last clarification, please. Does vitamin D work instead of vaccination against COVID?
No, of course not. Of course not. Vitamin D does it. Yeah, vitamin D does not keep you from getting infected. It does nothing to keep you from getting infected. The best thing you could do for yourself, I believe, is to be vaccinated. It's very clear. Follow the guidelines, the public health guidelines, social distancing, masks, and that's what we can do to keep from getting infected. Now, once you get infected, I think that this is a different layer of protection.
Oh, fantastic. And one last thing to comment about vitamin D. That was such a great presentation, and to bring up the importance of vitamin D. And you mentioned about how it's associated with. So for, those of us that work in this industry, we talk about associations, so we find it together, right? We find low vitamin D along with more severe COVID. We find low vitamin D with more multiple sclerosis. The thing that we do not know fully is it chicken or the egg scenario, right? So if we increase vitamin D, we can't say absolutely solidly we're going to reduce the person's risk of multiple sclerosis, right? But
Correct.
the hope is that we would, and I'm sure other things will come up more in the future with more studies coming about every day, right?
That's 100% true. And like I just briefly mentioned in the lecture, if you think about it, think about this vitamin that modulates 10% of our genome almost. I mean, it's amazing. For thousands and thousands of years, we were out in the sun, which is the primary way that we got it before, right? So it would make sense that it would have such an effect on our whole system, not just the pancreas or just this. It's located, vitamin D receptors are located all over in all different types of cells. So it does make a lot of sense.
Thank you so very much, Alex. Other note, Alex just mentioned that for thousands of years, we're outside, right? We're outside in the sun for hours a day. We're moving around. So reminder to get up and move.
Yes.
Thank you again, Alex.
Thank you, everyone. It's a great pleasure to be here and to share and to be part of this wonderful community. Thank you, Megan and Jay and everybody here for putting this together.